There are a lot of different periodontal files on the market, but we find that these two are the most common. So they are a little bit different if you notice. This has the cutting edges on the face, and then on the other end it has it on the back. This file over here has it on the lateral side, and then on the other end it has on the other lateral side. With the different files, this one, when you notice it has the cutting edges on the face, this one's used for the mesial and the distal. This one with the cutting edges on the lateral sides, this is for the buccal and the lingual. And we'll show you in the mouth to make it a little bit easier to understand. To use a periodontal file, this is completely different than any of the other instruments we use because you don't have to stress about a 70-degree angle with it, with the cutting edges. If you do that, actually it's not effective. So you want a 2-point contact. That means the cutting edges are on the calculus and the terminal shank is touching the tooth. So just like this. Another thing with files is it has to be 100% on calculus. It's kind of strong so it can gouge cementum. So we want to make sure that your little cutting edges are on the calculus. So what you do is wiggle it sub, so it's on the calculus, lots of lateral pressure, terminal shank is touching the tooth, and then a short millimeter stroke with good wrist motion. So this instrument has the cutting edges on the face, so this is going to be for the distal of quad 1. How you do it is you work it sub till it's 100% on calculus, and then the terminal shank is touching the tooth, short millimeter strokes with lots of lateral pressure to crush the calculus, and then you're just going to wiggle it right out. Then we're going to explore and use our Gracie or ultrasonic to get the rest of the calculus off.